As part of our agenda today, you will hear from the rest of our governance members and the collaborative team. But first to our keynote, Paul Schmitz. Welcome all the way from Milwaukee, where it is yesterday right now, Paul. Paul will share his wisdom on centering equity in collective impact, and we'll discuss how we as leaders hold ourselves accountable for ensuring equity. So Paul, I'll hand over to you and welcome you to tomorrow and to the future. Thank you.
Thanks, Mark. I look at all of you and all I can say is the future looks bright. And where you are, I'm a year older than I am here because my birthday is May 6th, but it's still May 5th here where I am. So I'm like trying to do the mind bend around the idea that I'm a year older where you are than here, and like how that all works and whether I can like manipulate that in some way to for my benefit. But it's great to be with you all from America, where we're very collaborative and calm and nothing's happening here. We're all like, everything's cool. Like it's a lot going on here as well, and in our country and in our communities. And it's great to have this chance to kind of share with you some of what we're learning, at least around this work, which has been so important. I have spent the last, I came to Collective Impact and this work when I was part of President Obama's Domestic Policy Council. I had led a national nonprofit in the US for 21 years that did grassroots community building in 25 cities. And through that work became part of the President's White House Council for Community Solutions. And a lot of people said to us, let's find those best evidence-based programs in the country and scale them up. And that made a certain amount of sense, but something kept gnawing at me about that. And it really hit me in April of 2010. The headline of my local newspaper that morning, in my hometown where I live, was that we had the worst reading scores for African-American children in the country. And yet that afternoon, I received a newsletter from the largest youth-serving organization in the city, boasting about all the outcomes it was achieving with the 15,000 children they serve. And that disconnect really hit me about like thinking about how many great programs we had in our community and the outcomes they were producing and the good work they were doing. But when we added it all up, we still had these awful results at the community level. And I went back to the council and said, what if instead of looking for great programs, we looked at, are there cities where they've moved the whole population measure? Is there a city where the reading scores are up 20 points or teen pregnancy has been cut in half? And let's look at those. And we found about 25 cities that had had major changes like that. And we found these same practices in all of them. And out of that work, we helped create the Collective Impact Forum, which spun out at that time. And for the last 8 years, I've been a senior advisor to the Collective Impact Forum and have, previous to the pandemic, was spending 60% of my time on the road, traveling around, talking to people. I've made 2 visits to New Zealand in the past. Since that time, I've been doing it all on Zoom with a little bit of travel. But over the course of time, I've visited more than 200 collective impact efforts. And last year, in the fall, was the 10th anniversary of the original article that coined the term collective impact. And I like to point out, they didn't invent collective impact with the article. They were describing something they had seen where communities asked the same question I asked. Why are there all these great programs doing good work, but when we add it up, we're not seeing the needle move on these hard issues in our community? And they'd come up with the same thing. And that's what I want to talk about today, is what we've come to learn about collective impact and how we're kind of thinking about those practices, especially in terms of equity. And to start, I want to start with the definition. We actually, as part of our kind of 10th anniversary look at the field, we asked what have we learned over the last 10 years, and what's the most important thing we could share after 10 years of doing this work? And we decided that the most important thing we could share was about the fact that this work really needs to center on equity to be effective. If we're trying to move population level change, the work has to be equitable. And we came up with a new or a renewed definition of collective impact that focuses on the fact that it's a network of community members, including residents and people with lived experience, organizations and institutions that advance equity by learning together, aligning and integrating their actions to achieve population and systems level change. And so the idea here is that what we're always aiming at is to have equity in our communities. We want all people to be able to fulfill their potential, even though people start in very different places. To do that, we have to move the change at the population level or system level that produces that. And the way we do that is by bringing these networks together and helping them to learn and coordinate and align and integrate their work to get there. And so when we think about collective impact, it really is about this kind of idea of how do we work with networks to advance their work in ways that create system and population change. We've typically thought of collective impact as having 5 key elements. The first is a common agenda, a strategy that's very clear and precise, that is organized around what's the change we're trying to move, and has strategies that are at the scale and sophistication necessary to move that needle. So if I'm trying to reduce infant mortality in an area of the city where there are 15,000 women of childbearing age and 1,500 live births a year, I can't say my strategy is to do a mentoring program for 50 women and to do 3 workshops a year. I have to think, what would it really take to move 1,500 birth outcomes in a more positive direction? And so my strategy or the agenda we create needs to really figure out what would it really take to move that needle. Then once we've identified that strategy, we've got to be able to share data and measure our progress together. So we've got to be able to collect and measure data across organizations and groups to see how we're making progress on our agenda and to adjust as we move along. In an effort here that was working on teen pregnancy, in the early years, they noticed that for the Latino population in my city, it was going down, it was not going down where it was for the Black and white populations. And so they then adapted their strategy, pulled in a new task force of people because they were looking at data and measuring progress in real time and adjusting as they went. Whoops. Then we have to align action. That the idea is that often to get that agenda accomplished, we need multiple organizations or groups working together to make that work happen. And sometimes that also importantly includes community members. As often the people who can have the most influence on people who are intended beneficiaries are the people closest to them. But we've got to make sure that we're aligning all the people needed to move that population together towards that outcome. To do that, we have to have a form of continuous engagement. We got to be bringing people together. There's meetings where we're coordinating action. There's ways we're bringing people together, collaborate. We're doing engagement of community members. And to keep all this going, to keep this strategy moving, to collect data and evaluate and share measurements so we can align our work, to keep people coordinated and moving in the same direction, and to facilitate all the engagement, we need a backbone staff who are skilled at doing the facilitation and project management to kind of keep everyone moving forward. So when we think about collective impact, we think about these 5 elements being brought together. And simply, what we also find is that they're really just the best practices effective coalitions have always done. When we look at coalitions through history, we find that they typically have this clear, really precise agenda. They're measuring progress. They're aligning partners to work together. They're continuing to meet, and they're facilitating and managing people to work together to get it done. And so that's in a simple sense of what collective impact is. But as I shared, the thing that we found is that one of the most important things people can learn about doing this work has to do with equity. And in our lessons, we found that the clearer the strategy, the easier it is for people to commit, that the form of a collective impact has to follow the strategy or function of what it does, and that culture eats strategy for breakfast. That if we build a collective to move a set of goals, but we don't build a culture that is more inclusive, more collaborative, more accountable, more equitable, that trust and other things will break down and often get in the way of our ability to achieve results. So to do those 5 things well, we've got to make sure the strategy is really clear, because that's what gets people to the table. We need to make sure we organize people around that strategy, and we've got to build a culture. And to do these 3 things well, equity has to be there. Equity has to be there in what the strategy is. It has to be in who we bring around what tables to do the work. And we have to build a culture that embraces it. So let me talk about what equity is. That historically in our context, where I am in the US and in many other places I've been, our approach in philanthropy, policy, and social service has been more around equality. The idea that if we get people equal access to the same opportunities or services or interventions, then we expect that they'll all get to the same results. And what we found in when we look at data is that doesn't happen, because people start in different places and have different barriers. And so an equity approach acknowledges that people start in different places, and to move people towards the result that we'd love everyone to get to, we have to differentiate what we do. The definition we use is that equity is fairness and justice achieved through systematically assessing and addressing disparities in opportunities, outcomes, and representation, and redressing those disparities through targeted actions. So we're looking at, where does disparity exist in the opportunities for people and the outcomes they're achieving, and in who's at the tables making decisions? And then how do we redress those through taking targeted actions so we can move to a more equitable situation? To do that, we identified 5 strategies that help groups center equity in the work of collective impact. The first is grounding the work in data and context and targeting solutions. And to that, there's a practice called targeted universalism. And simply it's saying, we have a universal goal. Let's say that universal goal is that we'd like all kids to read at grade level in 3rd grade. We then disaggregate the data in our community about who's achieving that goal and who isn't, and understand if there are disparities among different subpopulation groups, by race, by geography, by gender, or other differences. But we look to see, are there some populations further behind than others in relationship to our goal? Then for those populations further behind, we have to ask, are there specific structures or things that might be impeding that group differently than other groups? And then we target our work towards those impediments so we can move everybody to that goal. And so the idea of really targeted universalism is the notion that with data, we can understand where disparities are, and then differentiate our work to make sure that every population has a pathway to the goal, versus providing the same service to everyone, not acknowledging that different groups have different impediments or things in their way. So that's the first piece around really the data and targeting the work and grounding that work. The second is focusing on systems change, including, in addition to programs and services. If we understand that the impediments that often block people might not be just in their lives who we're trying to serve, but might be larger systems or structures that are in the way, then we recognize that we might have to address systems changes. And when we talk about systems change, we're talking about changing the conditions that hold the problem in place, those larger structures or systems that might be preventing people from moving forward. And that can include things like mental models and narratives, the way people understand the issue, or biases people hold about the issue or the population with that issue. Relationships and connections, the ways in which the people who do the work on that issue are connected or not, can be getting in the way of people being helped. So if we have, if we're working on education and the after school programs don't know which kids are falling behind in school, but the kids go there after school every day and they don't know which kids are ahead or behind, that lack of connection is preventing them from most effectively helping those kids. And so recognizing where are those breaks in relationships and connections in our system that can be getting in the way. Power dynamics, who has power in decision-making on the issue and who's heard and listened to, could be something getting in the way, as the people who are making decisions might not know the issue or the people well enough to do that. And that could be blocking progress. The way resources flow to the issue could be a system that is getting in the way. The rules and practices and the ways the work is done. And then finally, public policies. And so when we think about equity, we have to think about not just how do we serve the person, but are there larger systems changes that are necessary if we're going to allow that population to have a better path towards the outcomes we're seeking? And so thinking of systems change as well as programs and interventions when we think about what's needed to create equitable outcomes. The third is about shifting power within the collaborative. And there we have to understand that we define power as the ability or authority to influence others, to decide who will have access to resources and to define reality or exercise control over oneself and others. We look at formal authority, which is those who are in a position where they control resources or decisions, and informal authority, which is those who have influence that result from the level of relationship and credibility they have with stakeholders. And when building a table, we need both. We need people with formal authority, but when we have people who have formal authority, often they can act in ways that demonstrate that power imbalance. And so we have to find ways. We can never solve for the fact that some people probably have more power than others by virtue of controlling resources, but there are things we can do to mitigate that in terms of, again, how we build the culture, how we build agreements, how we build the group to do that. We also have to get real about who's at the tables and how do we build tables to be ready to share power. And if we imagine at the center of the table where we're making decisions, the intended beneficiaries, the issues they're experiencing and the neighborhoods they live in, we have to ask ourselves, how many of us live in the neighborhoods we're trying to impact or have lived in those neighborhoods or have family members who live there? How many of us reflect or represent the target population that we're working with or represent other marginalized groups? How many of us have personal lived experience on the issues we're trying to address, or even have family members with that? How many of us directly work with that target population every day and are in a direct relationship and proximity? How many of us manage people who do? And the reality is, if we're all on the outside, do we really have the best information about the people, the issues, and the neighborhoods they live in to make the best decisions? And so as we think about power, we also have to recognize that if we don't, we have to give up some of our power at times to make sure we're doing the right things and to share power, because we always don't have the answers. And so if we think about kind of who's at the table, that's one way to analyze where power sits and recognize where we need that to exist. The fourth is about listening to and acting with community, and really thinking about the role of lived experience in that. And we often think of the approach of asset-based community development and the notion of, is the glass half empty or half full? And the correct answer, of course, is it's both. And that every single one of us here today, all the people we work with and all the people we serve, all have fullness. We all have gifts and talents that help us be great family members and friends and workers and leaders and things we love to do and skills we have. We have all of that. But all of us also have emptiness. We have things we don't do well, mistakes we've made, regrets we hold. But community service is often defined as people who are defined by their fullness, going into communities that are defined by their emptiness to help people who've often been labeled by their emptiness with the notion our job is to fill them up with some of our fullness. We think at best that's arrogant and at worst oppressive. And that to do this work in an equitable way, we have to flip the way we think things in a more asset-based approach and understand that everybody has both. And it's a question of, as leaders, where are we starting? What are we looking for? What are we recognizing and lifting up? And to understand that in any community where we find all of these issues, and they exist in my community. And if I wanted to find all these things right now in my city, I could find them. But I can also tell you, in the exact same neighborhoods, I could find all of these things. I could find all of these things as well. And so if we think in an equitable way about community, being asset-based and thinking about acting and listening to community, we have to understand that these assets exist, and how do we think of our community in a more asset-based way and recognize all of the gifts and talents of people in the community we can rely on and partner with in order to produce outcomes. And when we start to think like this, we start to recognize that the woman who checks in on the young mothers in her neighborhood is part of public health in your community, that the man who watches the kids after school on the playground is part of youth development in your community, and to start to understand that community itself is a form of solution. And then we have to think about, what's the role of community in solving problems? And what's the promise we make to community in terms of how we're going to do that? And so this is a simple model that's called the community engagement spectrum we like to think about. And simply put, on the left side is, we make decisions, and our role is to inform the community of our decisions and orient them to the change we're bringing. Consult is, before we make a decision, we're going to listen to community and get some perspective from them that we can consider before we make decision. And then we need to let them know how their point of view influenced or didn't our decision. Then there's involved, which is at every step of our process, we're listening to community and engaging community, from defining the problem to exploring options to making decisions. Collaborate is that we partner with the community, that at every level of our process, the community is co-equal to the agencies or leaders in making decisions about what's happening in community. And empower is community members make decisions and we support whatever they decide. The challenge we see is, too often people use language on the right side of the spectrum, but deliver engagement on the left side, which creates a lot of dissonance and often builds distrust. We think wherever you are on the spectrum, you have to make that promise and fulfill that promise, and not promise more than you're willing to deliver. But we think every group should always ask themselves, what would it take for us to take a step to the right? And to think, as a colleague did, we wrote about in our article, before they make decisions, the people with lived experience in the room have the last word. Or with another group I'm working with, where they've built a table, a resident leadership table, that sits between their action networks, which lead their collective impacts, in their steering committee. And they decide, the work from the action committees gets reviewed by the resident table, and they make recommendations to the board based on it, so that they're the ones overseeing that work. There's lots of ways people have creatively thought about, how do we shift power and listen to community in new ways, and really create that space for community to participate, and not just be listened to, but to be partners in the effort. In an area of my state where the farmer population has been really hit hard, the suicide rate among farmers is the highest in the state. They asked themselves, who do farmers trust? And they came up with answers like seed dealers, the mechanics, the equipment implementers, their bankers even. And what they did is they did mental health first aid training with those folks, recognizing that the people already in relationship with them were the best people to produce those outcomes versus outsiders they didn't know. And so when they thought about who can deliver outcomes, they didn't just think of agencies, they thought of who are the people closest to the people. So when we think about listen and act with community, it's both listening and acting. It's how is community part of the solution? And the final piece of centering equity is, how do we be accountable as leaders? If leadership's an act of responsibility, how do we act accountable? How are we accountable for equity as leaders? And we've come up with some practices that we think help leaders who are in formal authority roles at this point be more accountable for leading with equity. The first is that they seek out authentic relationships to share and learn. that they're self-aware of their need and recognize, who do I listen to? What's the bubble I'm in? How do I build relationships with people who are different from myself, and really share and learn, whether they're at the same status level I am, but really trying to think about, how do I broaden the level of relationships I have and that I listen to? That they make visible commitments that with clear goals and expectations, and invite those employees or stakeholders in their groups to hold them accountable. So they say, we're not going to host any meetings where at least the majority of people in the room don't come from X community. And we'll be accountable for that. They make clear commitments and invite people to hold them accountable for that. The third is that they, if they're leading an organization, they look at their policies and their compensation promotion and analyze them to see, are there biases or disparities? And then they set clear goals around where those disparities are and think about, what do we need to do? And if they find that there are problems, they redress those harms. And they acknowledge what harm that's done. The fifth is that they make sure, if they're at tables, that they're making sure that there's diversity at those tables, that they won't make or enable decisions without those perspectives and participation being heard. The sixth is building and sharing power, transmitting it and your privilege and not hoarding it. And here, the example I always like to give is when people think about, like, when people have power and privilege, there's two things you can do with it. You can hold it for people like yourself. So you see an internship and you contact the college that you went to, and you ask the professor for some of the best students, versus thinking more broadly about what other kinds of people could you offer opportunity to. Or you see opportunities and you let people you're close to know about them, but you don't think, who are people who might not have access to this knowledge, and how do I help get information to them? To how do you break the cycle of reinforcing privilege and who gets opportunities, and think and break outside of that. The seventh is and we use the example of people of color, but showing up for leaders of color, people different from yourself, and their organizations and public issues impacting those communities, not just when your organization's interests are at stake. So when there's an important issue facing a community that you care about, do you show up even when it doesn't affect your self-interest? And that shows people that you're truly committed, not just for yourself, but you're committed to them. And finally, are you willing to take stands and even make risk or sacrifice of resources and relationships in order to stand up for racial equity and justice? I worked with and coached a CEO of a community foundation who had a major donor who at a public event made a racist comment. And she was stunned by it and confronted him at the event. But it was risky because he was one of the largest donors to their foundation. And she went to her board and said, we as an organization made a commitment that racial equity is our North Star. This person clearly doesn't share that value. Should we take their money? And their board made the decision to no longer take this donor's money. And the signal that sent to the community about how serious they were about being accountable for equity was huge. And the trust that they built with community by that was huge, because they showed they were willing to risk resources and sacrifice resources for their values. So these are just examples of ways that leaders can be accountable for practicing equity. So again, you ground the work in data and context and target solutions. You focus not just on programs, but system changes. You think about, how are we shifting power and making sure we're not reinforcing the way society normally works within our group. We're listening and acting with community and listening to that lived experience. And we're building equity leadership and making sure that we're being accountable for equity in our work. Those are ways we found that groups can effectively do racial equity work within collective impact. And so what we talked about doing is we'd like to break you up for a few minutes. And we've given you some reflection questions. And I've put those in the chat. And what we'd like you to think about, we're going to break you into small groups for about 15 minutes. We'd like you to think about, What are our current strengths in terms of centering equity as a North Star of our work? How do we balance power differences when collaborating? And how are we holding ourselves accountable for equity as leaders? So we'd like you to spend some time together talking about this, and then we'll come back and I'd love to hear from each of the breakout groups. So if someone in each group could agree to be kind of your spokesperson when we come back, that'd be great. And then we can see if there's any questions. But if that's okay, then I think we're going to send you to your breakouts, and then we'll come back and have a conversation. Michael, you ready? Did everyone get invited to a room?
Yeah, everyone should have gotten an invite to a room. So unless, are you having trouble there, Gary, or? Nah, kia ora.
All right.
Cool. I will pause the recording just for a little bit.
Hey, everyone, welcome back. And would love to hear, I can't see who was with who, but if I could ask some of the people who, I had asked if each group could have someone just kind of share a few reflections on your conversation or some questions, I would love that. Who would like to start me out?
Kia ora, Paul, it's Lance here. We had the,
Hey,
I
Lance.
think we had the best group, so I don't know how they chose it, but all the top people were in our group. And then one of the, so our conversation started on, how do we get to where we are today? And then how, in terms of this equity conversation. And the first thing we acknowledge is that we've all taken 2 hours out of our day to be here. We could have been doing other mahi today, but we've actively chosen to participate in this conversation. Yeah. And then that got us thinking about, not me personally, but if you've had alcohol issues, well, I've had those, but I haven't had alcohol counselling. The first part of moving forward is acknowledging there's a problem before you actually do that. So I think a big part of this group and our country is we've acknowledged there's a problem in the healthcare system. In the early 1980s before, we wouldn't be talking about racism and equity, and we all want the same access of opportunities. So we've now acknowledged that. And then as a country, we've gone through internationally Black Lives Matter, the Me Too movement. If you recall, in our country, it was illegal to be a gay and lesbian partnership, legal partnership 20 or 30 years ago. Unfortunately, we had the Christchurch terrorist attacks. The country got behind our Muslim community. So I think what you're finding is there's more social awareness on injustices across multiple areas. And therefore, this thing called equity is more at the forefront than it may have been historically. And because we're talking about it, and in about 38 days, we'll probably have 40 days, we'll have a piece of legislation that says we actively need to address that through our legislation. So our group was the acknowledgement part of it, the fact that we've acknowledged there was a power imbalance, and we're trying to rectify that. There's still a way to go, right? Because acknowledgement without action just becomes the same. But moving into a sort of revised healthcare system where there is more focus, data will be quite key. That came out of our session. And the data tells you some good stories, but sort of a little bit of self-reflection is what our group had as well, in terms of, well, actually, we've personally gone through some events where we may have recognized the situation could have gone, we could have done things better, and could have the outcome could have been different. But because of that acknowledgement, we've sort of reflected and adjusted our behavior going forward, which is a good thing.
Yeah.
So that
great,
that
Lance. Thank you so much. Yeah, that's great. And I agree on the acknowledging. I mean, we're having a fight in the United States right now because we for years have been acknowledging, and now people are trying to get us to, are passing bills trying to get us to stop acknowledging. So like, it's still, I don't want to minimize that piece of it, because we have to own the history in order to correct for it and redress it. And so that is important. And at the same time, I agree, the actions matter, but it's a start to at least begin the space of making that part of the conversation and taking time to have the conversation. Thanks, Lance. Who else would like to share some about your conversation?
I'll go next if you like. Sorry, and apologies,
Great.
I'm having trouble with my camera at the moment, but
okay.
I've got my IT person trying to sort me out. So as soon as I can, I will come back online. But we actually had the top group, Lance. Sorry to have to tell you that. I think you were sadly mistaken. We talked about some of our current strengths in terms of equity, some of the activities and commitments that we've made within our own organisations. We talked about the importance of culture and embedding a culture of equity across organisation, and it starts at governance, and it needs to filter through everybody so that everyone who's part of the organisation understands equity and the role they play in their role in eliminating inequity. We also talked about the importance of utilising data and knowledge to ensure that we are directing our precious resource in the right areas, and the advancements in our ability to do that lately have, we've gone on leaps and bounds. So that's something that we do think is a current strength, and certainly I'll speak on behalf of other PHOs, I'm sure they'll agree. We wholly rely on that data and intelligence to make sure funding is being directed appropriately. And then we talked about the second part of our discussion was around how do we make sure that we are addressing any power imbalances in the new world when we come together as locality networks. We talked about the importance of, again, relationship being number one, taking that time to understand our collective contributions and each bringing our strengths to the locality work. The importance of everybody having a voice, so agreeing principles in which how localities need to work together. And particularly if there is a backbone organisation that holds the purse strings or that has that control, then we need to have a very clear principled approach in terms of how we're going to work together relationally. And I believe the collaborative partnership charter or locality partnership charter will hopefully support that work.
Great. Lindsay, thank you so much. That's a lot.
Yes.
You guys hit it out of the park on that one. You guys hit every topic. That's great.
Thank you.
Thank you. Let's hear from another group, and I just want to make sure we get to your council meeting on time.
I'll go next. Kia ora, Paul. Just like to mahi to Lindsay and Lance for the contributions, and we've said probably got a similar theme running through our kōrero to what Lance and Lindsay have just suggested. So I won't repeat that. I'm going to add a bit of the new stuff, I suppose, that that hasn't been talked about. We talked about the importance of indigenising spaces, actually, and getting clear around what that means, and getting out of the way. Bureaucracy, the hierarchy, we feel that that's an area that we could be working on. We're particularly interested in two of your slides, one around power shift and system review, system change. We'd like to explore that a little bit more. We talked at length about having Te Tiriti o Waitangi knowledge, historical and legal, and not turning that into practical application on the ground to make a shift on the needle. So we talked about that as being a challenge. And we had a really wonderful example from Barb in our group around what you described in terms of collective impact happening on the ground with a whole lot of people who are doing good community work and are by nature public health practitioners. And actually, we're really keen to see more and more of that in the localities and really opening that up and exploring community-driven mahi. So I hope that's done justice to what we talked about, Barb, Martin, and Amaja. Kia ora.
Ngā mihi.
I do a quick
Great,
update
thank you,
from our
Jo.
group, very, very quick.
Yes, please. Yeah.
Just not to repeat what others have said, manakitanga, centering around Te Tiriti, getting it right for Māori, we'll get it right for everyone. But I think one of the striking things from our group as well was metrics and data. Yep, they tell a story, but they don't always tell the story of what people want. So listening to what people want, I think Marie's comment, 2 ears, 1 mouth, and really engaging with what matters to communities. And yep, smoking rates might be the top priority if you look at the data, but actually it might be food on the table and being safe at night. Thank you, Mark, for really understanding what matters to communities. And then courage and being held accountable, making sure that boards can stand up and talk to what matters and implement what matters. So yeah, hopefully that will reflect the A team.
Great, thank you, Maura, and thank you, Joe and Lindsay and Lance too, and for all of your things. Did that cover all the groups? There were 4 breakouts, right?
There might have been 5, but if everyone has spoken or everyone who wants
Have we
to
heard from
speak
each
has
group?
spoken.
And
Yeah,
thanks,
kia ora,
Gary,
looks
for
like
adding
it.
in the chat too. So again, like a couple things. One is the slides I used today, I'll send a PDF to Amarjeet. I sent the last one and I'll send the one for today right when we're done. I'll also send, there's an article called The Water Systems Change that lays out that pyramid that you asked about, and a toolkit on community engagement that goes through some of, or an article on community engagement that goes through that power shifting paradigm. So happy to share those with you and free to share those. I think it's great that you guys are thinking about how you adapt the collective impact approach to your organizations and dealing with health in your region. And it sounds like you're very thoughtful about this issue of equity within it, which is, again, we just find really central if we're trying to move change. If we want to get to real impact, we find that's the lack of that focus is one thing that holds us back. And so really appreciate you all. Wanted to see, there's just a few minutes left. If there's any like quick question or anything I could cover before we hand it back to Mark and the rest of your meeting.
Thank you, Paul. So open up for questions if anybody has any.
Oh, kia ora team, not a question, but in New Zealand, there's an organisation called Social Value Aotearoa, and they're connected into the international SVA social values stuff. So I'd encourage, so all the stuff that we've been presented on today, if you wanted to plug into that locally, I think it's sva.co.nz or .com. But your social, I'll dig out the website link and I'll chuck it into the group chat.
Thank you, Lance.
Thank you, Lance.
Okay, well, if there are no questions or comments, Paul, I'd like to thank you very much. Fascinating, invigorating, reinforcing information that I think we've all got some challenges and some comfort from. So just a brilliant, and look, thank you for the slides as well. And the breakout session, I think, did prompt some really interesting conversation from the minor groups as well as mine. And I think where we landed was a good space. So really appreciate your time and for dialing in. And I was reminded just after you talked about your birthday and dates and ages, many of you will know the great Yogi Berra, who was cited with many, many interesting sayings like, it's deja vu all over again, or nobody goes there anymore, it's too crowded. But he did say something equally funny, but probably genius, which was the future ain't what it used to be.
That's true.
People used to laugh at that, but the future ain't what it used to be.
Yeah.
In 1977, I was expecting by now to have a flying car and food in pill form. But aside from that, the world changes continuously. So Yogi had a wee bit of genius.
Mark, you were watching the Jetsons too much, but that's okay.
Absolutely.
Thank you, everyone. Great to be with you. And I just want to shout out to Curia with the comment on bravery, which is also really critical to this work, that we have to, leadership requires courage, and leadership for equity requires courage. And we've got to be willing to put that forward. So thank you, everybody. I'll let you go on with the rest of your council meeting. And if there's other ways I can be helpful, let me know. Thanks, everyone.
Thank you, Paul.
Bye-bye.